Hello, everyone. It's DrCary Yurkiw. Thank you for joining us today for our Whiplash webinar. Today, I want to talk about different types of whiplash that we see in the clinic, what the symptoms are, and then how we help people that suffer from whiplash. Just going to turn off my video. I'll turn it back on at various times throughout the webinar. And we'll go over to the first slide. Again, my name is DrCary Yurkiw. It's my 27th year of practice, and I'm from Winnipeg originally. That's where I grew up. Went to the Canadian Memorial Chiropractic College in Toronto. Currently, I'm in Kelowna, British Columbia. Some of the passions and things I love to do, I love spending time with my family. I love running, and you'll see me talk about running quite a bit, and I love cooking. And lately, been cooking more vegetarian type of dishes. So these are some of the passions that I have and some of the priorities in my life. And we've seen a lot of people over the years with whiplash. I think I've seen 500 to 1,000 whiplash cases would be conservative, but definitely have seen a lot of whiplash and a lot of neck injuries, headaches, and other types of problems that we're going to discuss today from people that have had whiplash. Most of the time, whiplash happens in a car accident, so we'll be focusing on that today, but we have seen whiplash type of symptoms in collisions like sports, or when maybe somebody's on their bicycle and they have an injury and they hit something with their bike. So we have seen collisions that have caused whiplash-like symptoms as well. So today we're going to talk about whiplash. And just a disclaimer before we start, if you do suffer from whiplash, I would encourage you to be assessed by a health professional in your area to be properly diagnosed. Once you're properly diagnosed, then giving you the best and advice for your condition will be easy. Today I'll be talking in general about different conditions that we see in the clinic, but it's best to be assessed by a healthcare professional. If you're in the Kelowna area, you can definitely contact me and then get your condition assessed and treated properly. The anatomy of the neck, there's 7 vertebrae in the neck area. There's discs in between the bones. There's joints and cartilage in between the bones that cushion the bones and allow for movement. The main function of the neck area is to protect the spinal cord, and the spinal cord runs inside the neck area, and it travels from the brain all the way down to the body, to the organs, to the tips of your toes, the tips of your fingers. So basically the nervous system goes everywhere, and then back from the body up to the brain through the spinal cord. So the spine protects the spinal cord, allows the signals to get through, the electricity to flow, and it allows you to move, bend, and twist. And when someone comes into our clinic, the movements that we assess them for are flexion, bending your head forward, extension, bending the head backward. And when we see people that have had accidents like a rear end type of injury, most often we see this type of flexion extension injury where there's a whipping of the head forward and backward. We do assess twisting or rotation to the right and left, and then side bending, which is lateral bending. We do see this sometimes in car accidents as well, especially if somebody gets T-boned, and that's the word a lot of patients use. If they're hit from the side, there's a lateral or sideways whipping if you're looking straight ahead. Now, if you're turned your head and you're looking at the oncoming car and they hit you from the side, there's going to be a lateral type of movement as well as a rotation type of injury. So we see a number of different forces put on the spine and injuries, and then the treatment has to be designed to correct that type of injury. The physiology of the neck, there's nerves that run through the neck area. One nerve root comes out of the right side and one out of the left side at every level of the spine. There's blood vessels running through the area. There's the carotid arteries, the vertebral arteries in the back part of the spine. And there's a number of different, the jugular vein and a number of veins coming back from the brain to the heart through the neck area. There's muscles around the spine, different layers of muscles. Some of them are quite small, going from bone to bone. Some are a little longer that are spanning 2 bones or more. There's ligaments holding the bones together, including the discs, which are like jelly donuts in between the bones. And then there's synovial fluid that allows for movement, fluid movement in between the bones. So what happens when there's a whiplash type of injury? Well, there's a whipping movement of the head forward and backward. And if you're traveling at a significant speed, let's say you're going at 60 kilometers an hour, 35 miles an hour, and you hit something like a car, your body's still going forward at that speed, but the car stops abruptly. And the head is free to move forward at that same speed, that momentum, which then the neck resists the head moving forward. And that's what causes that whiplash type of injury. So there's that whipping movement that's quite traumatic. The faster you're going, the more traumatic it is. And the head is quite heavy, so it acts like a pendulum. It kind of goes forward and backward. The force stretches and tears the tissues. It can cause instability or weakness in that area, and then scar tissue forms to start to repair the tissues. And I always say to people, the sooner you can come into the clinic right after a whiplash type of injury, the better, because the longer it goes on, the more scar tissue that sets up gets harder to treat as time goes on. What are some whiplash type of symptoms? Well, neck pain and stiffness is very common. Worsening pain with movement, loss of range of motion, headaches, tenderness or pain in the shoulders, upper back and arms, fatigue and dizziness. These are common symptoms we see with people that have had whiplash. Other symptoms, blurred vision, tinnitus, which is like a ringing in the ears, sleep disturbances, irritability, difficulty concentrating, memory problems, and depression. And this is when there's been some nerve trauma. Sometimes the brain has been affected. There could be a concussion-like symptoms, which can result in other whiplash-related symptoms. When should you come and see a chiropractor? Well, as soon as possible after the accident. We'll do an assessment for you, determine what the deficit is from the injury. We want to reduce scar tissue and work with that tissue as soon as possible, not letting it set up or become chronic. We want to reduce the chance of long-standing deficits, so we want to correct the injury as soon as possible. And we want to start that healing process so you feel better. What do we do for an assessment? Well, we're going to do the history, find out what kind of mechanism caused the whiplash. Were you hit from the side or from the back, or was there some rotation? We're going to do an examination and document that. We'll send those exam results to your car insurance company. In British Columbia, we have ICBC, and we bill directly to them. We'll take x-rays if necessary. We have digital x-ray in the clinic, so we'll take those x-rays to show you the alignment of the spine, to review if there's any pathology or trauma that we can see on those x-rays. And once we have a diagnosis, then we will relay that diagnosis to you and to the car insurance company and start treatment. And we'll recommend care over a period of time. Generally, for whiplash, it can take 2 to 3 months to treat someone. And then we'll make some recommendations for you to take home with you, which we'll go over in the coming slides. So what is treatment like? Well, we do adjustments, and the adjustments are done usually hands-on. So we'll do the hands-on adjustments, gently mobilizing the neck, adjusting the neck, using instruments to do that. Sometimes we'll use tables in the clinic, but the table type of adjustments are more for the lower part of the spine. We'll use ice or heat, and we'll recommend one or the other for you, sometimes a combination of both. We'll recommend supports like pillows for you. And in British Columbia, ICBC will generally cover approximately 24 visits over a 12-week period. So we have some time to get you feeling better, to restore the function of the of the neck area and to reduce and eliminate symptoms so that you're back to pre-accident status. That's what our goal is. And we bill directly to ICBC. You don't have to worry about paying for the sessions. You just have to let ICBC know that you've been in an accident. You're going to go and see the chiropractor, and then you'll bring in the claim number to us and we'll take it from there. Some other supportive changes that we give patients are stretches and exercises, postural changes, and this is as they're progressing through care. Some ergonomic changes like their workstation, the way they sit in their car, even sleep posture are some of the things we'll talk about. Some lifestyle changes that you can make as far as nutrition for the healing process, stress management, and exercise. So those are the common lifestyle changes that we recommend in the clinic. As far as ICBC goes and the billing, I covered these. You just have to get a claim number and bring the claim number into us and we'll bill directly. And if it's a complicated case, we have the ability to ask for an extension if needed, if the neck pain and the whiplash isn't healing as quickly as a normal or an average case would. If you've had a car accident, we're currently taking new patients in Kelowna. The number to call is 250-486-0062. I did write a book on neck pain, and that was published on Amazon last year. It took a while to write that book, but it does include whiplash. So if you've had a whiplash or you know somebody who's had one, certainly go to Amazon, type in neck pain, and you can type in my name, DrCary Yurkiw, and you'll find that book. There's one on neck pain and one on back pain or low back pain. And they're in paperback, ebook, and there is Audible, an audiobook format as well. If you want to join us for upcoming webinars, we have quite a few webinars coming up on different types of conditions like back pain, hip pain, neck pain, and other joint pain. So go over to our Eventbrite site, type in DrCary Yurkiw on Eventbrite. You'll see the upcoming webinars. Most are free of charge. You just have to click and register, and then you'll get a link sent to you before the webinar with the passcode so you can join us. Our clinic's located at 105-1628 Dixon Avenue in Kelowna. The phone number is 250-486-0062. And my email address, drcaryyurkiw@gmail.com. If you want to ask any questions from today's webinar, feel free to send me an email. Not everyone can write in the chat or type a question, or maybe you think of something later. So feel free to email me any questions. On Instagram, Facebook, and Twitter, our handle is DrCary Yurkiw, pretty straightforward. And we're pretty active on social media, letting you know what the upcoming events are, what we've been doing in the clinic. So we try to engage our followers on a regular basis and answer any questions. Be sure to follow us so you can stay up to date on what's going on in the clinic. We have a YouTube channel. We record these webinars and put them on YouTube. It's DrCary Yurkiw. We do have a podcast on Anchor called Super Healthy, which gets distributed on Apple and Spotify and a number of different major podcast distribution channels. Make sure you follow us on Super Healthy because that's a different format than the video format. So it's audio. I really enjoy doing those podcasts and listening to different types of podcasts through Apple Podcasts. And then our website